morning, everybody. My name is Dr. Kong. I'm a consultant physician and nephrologist. I'm also the co-founder and director of Elder Love Living Care and Rehabilitation Center, and also Missi Care. Today, I'm going to talk to you about influenza and flu vaccination. I think this title is quite relevant during this holiday season. So, what is influenza? So influenza, commonly known as the flu. Yeah, I'm quite sure you have all heard about the flu. It is a serious contagious respiratory illness caused by the influenza viruses. So it can cause mild to severe illness, sometimes resulting in hospitalization and even death. It's not something to take lightly on. So the elderly, young children, and people with certain health conditions are at very high risk for serious flu complications. I'm quite sure you all have seen the picture of a coronavirus, right? Yeah, everybody is talking about the COVID-19 virus. So how about influenza virus? Have you seen a picture of it? If you haven't, I'm going to show you a picture. So it looks something like this. So in the influenza virus is a single-strand RNA virus from the Otomyxoviridae family. So there has three types of influenza viruses, A, B, and C. Usually, we see type A and type B in clinical setting. Type A usually cause moderate to severe illness, and it affect all age groups. But type B usually will show mild diseases, will cause mild diseases. Type C rarely reported in humans, but it has happened before. How about a little bit of history about the influenza virus? The name influenza originated in 15th century due to an epidemic in Italy. And back in those days, people doesn't have the knowledge. People attribute everything to the environment. So at that time, people attributed this virus to this epidemic to influence of the stars, and hence the name influenza. There was a first clearly documented pandemic in the year of 1580. But of course, in their history, multiple pandemic that seems to have been caused by influenza have already happened over the past few hundred years to even more than 1,000 years. But the first clearly documented one was back in the year of 1580. At 19th century, there was at least four pandemics. Yeah. And can you imagine back in those days, before the invention of the face mask, I'm quite sure a lot of people would have been affected or even die from the disease. So you have heard about the phrase Spanish flu, right? So Spanish flu is one of the worldwide pandemic of influenza infection back in 1918 to 1919. So in a span of about 2 years' time, it affected millions of people around the world, and reportedly it killed 21 million people, which is about 1% of the world population at the time. That's a big thing. But believe it or not, the virus was only first isolated in 1933. And before that, people thought influenza is actually a bacteria. For a few decades before, this virus was finally isolated in 1933. So these are a host of flu pandemics, the famous one, the significant ones, not to mention minor epidemics or minor pandemics. So these are the major ones that happened in the 20th century. As you can see, it includes the Spanish flu, a host of a few flu pandemics that happened in the Asian country, including the swine flu, the Hong Kong flu, the blood flu, and so on and so forth. So what are the symptoms of influenza? So a person can have fever, headache, dry cough, sore throat, extreme tiredness. These can all be symptoms of the influenza. Runny or stuffy nose, muscle aches, stomach symptoms such as nausea, vomiting, and diarrhea can happen with influenza infection as well. How does flu spread? Flu viruses spread mainly from person to first person from coughing or sneezing. yeah, essentially respiratory droplets. You may spread the virus to someone else even before you become symptomatic. So, how about the impact of this influenza infection? So, the impact is huge, essentially, as I mentioned, especially during the Spanish flu that happens almost 100 years ago. It killed almost 1% of the world population, which is a big thing. These days, it still affect and kill almost a quarter to one half of a million people per year around the world. This include tens of thousands of children. And of course, it costs tens of millions of hospitalization and causes few billions of dollars spent in the healthcare expenditure just for treating this infection. How to prevent getting flu, or should I say, how to prevent getting severe flu? The only way is to get vaccinated. So, how about the influenza vaccines? Influenza vaccines have really evolved throughout the years. When I was a medical student, the popular one was trivalent vaccine, which means the vaccine at the time cover two subtypes of A and one subtype of B influenza virus. Nowadays, this quadrivalent vaccine already cover two subtypes of A and also two subtypes of B. So it's quite a so-called all-rounded vaccines that can cover a lot of subtypes. So these quadrivalent vaccines are composed of inactivated viruses, and these inactivated viruses are grown in chicken eggs, and the final product contains residue egg protein, and this is for intramuscular injection. There is another form which is intranasal, which use live attenuated vaccine, but this is seldom used as compared to the intramuscular vaccine or the quadrivalent vaccine I was talking about just now. How does flu vaccine works? I'm quite sure you have read a lot about how the COVID-19 vaccine work, right? Essentially, it's almost the same. It applies the same principle. A lot of vaccines, most vaccines contain multiple inactive or weakened or kill strains of the virus that we are trying to protect via the vaccine. Once these vaccines were administered, the human immune system built antibodies that recognize these inactive flu strains. When the real active flu virus enter the body, the immune system is already prepared and is able to recognize the invasion and try to defend the host, yeah, the human. So this is how vaccine works. How about side effect of flu vaccines? Essentially, flu vaccines are quite well tolerated because millions of doses were given every year. The vast majority of the side effects are very minor, which usually is just soreness, redness, or swelling at the injection site that might only last for a day or two at most. And some people would develop low-grade fever, which is 37.8 degrees or less. Most of these minor side effects will abate quickly, and a person can take Panadol as needed if they are really in severe pain over the injection site or swelling or fever, as I mentioned. Contraindications means that who should not take the vaccine. So absolute contraindication are people with a severe allergy to eggs. As mentioned, all these flu vaccines were grown. The inactivated virus of this influenza virus was grown in egg. So eventually, the product, which is the flu vaccine, will contain some egg particle, egg protein. If a person is having severe allergy to egg, they can have severe allergy to flu vaccine as well. And another contraindication, or what we call absolute contraindication, are people who have had a reaction to the vaccine in the past. How about relative contraindication? It means maybe can give, but better not give. So there are people who have a moderate or severe illness with a fever. They should wait until their symptom lessen to get the vaccine. So this is not an absolute contraindication. You can still proceed, but better not at the same time where you are having some moderate or severe illness caused by other infections. So these are my only few slides. It's a rather short presentation. I thank you for your attention.